Wouldn't it be fun if you were a child in bed, sick, not being able to communicate properly, and the actors came to your bed and made you really happy and take you out of yourself completely, so you no longer felt miserable and you no longer felt sad? We started off in one facility, the Rusk Institute, and we're now in 13 hospitals, and we're in all the boroughs of Manhattan. And except Staten Island. Come on, Staten Island, sign on up.
Gonna have a good time, gonna have a good time, gonna have a good time, gonna have a good time. Oh, I believe, I believe, I believe in make-believe.
I'd been an active volunteer in child life programs in Manhattan for a number of years, and I wanted to start an organization that would bring together theater and children in need.
She wanted something for kids who couldn't go to the theater, either because they couldn't afford it or because they were institutionalized and weren't going to be able to get out.
Ow! Sorry.
So she came up with this idea of bringing actors into the hospital setting.
We go in for an hour a week for 6 weeks, and the first program really is an introduction to theater to give the kids an idea of what's ahead in the next few weeks. Then we do a different story each week, and then the last week we usually do the best of all of Only Make-Believe stories with the kids playing all the parts.
Going into a hospital site for 6 weeks allows the actors to develop a rapport with the kids, develop rapport with the parents, with the hospital staff. A trust develops between the kids and the actors, and you see that growth over the 6-week period.
And now the kid.
It's a brilliant idea. It's so beautifully simple. That adults should, by making fools of themselves in the company of young people who are going through a hard time, bring joy as well as better health into their lives.
Most of them are in these facilities for long term, and I mean long term, sometimes for their entire life.
The kids are chronically ill. They're suffering from psychiatric disorders. They're suffering from cancer, HIV disease. They're living in long-term care, nursing homes.
So that for some of these children, this is the only outside world that comes to them.
I like them because I was here for a year and I saw them the last time. I was here for the last time too. That's why I liked it so much and I came today.
What we've realized is that stimulating a child's creativity is therapeutic in itself. The program stimulates creativity, it builds self-esteem, kids learn to interact with each other, and parents get to sit and watch a program with their kids and see their child shine.
When we have an amazing opportunity where someone comes in and gives us their skills and participates with our families, and we don't have to modify our budget to make it happen, that's spectacular.
The staff, whenever we have events, but especially Only Make-Believe, I find they come on down to the playroom, they want to peek through and see what's going on. They start clapping their hands during the song. The parents, they come, and it breaks up their routine too. It lets them see their child smile and happy and engaging, and it even lets the parents kind of escape from the effect that the hospitalization would have on them.
We actually had one group of kids who were coming referred because they were what's called selectively mute. They didn't talk except in their house with their families. They wouldn't speak with other kids in school, not with friends. And so we weren't sure how that was going to work, but we included them in Only Make-Believe, and to the amazement of the families and the staff, this one little boy got up and he was singing and participating, and he doesn't have to come anymore because he's fine now.
The difference between Only Make-Believe and most other therapeutic programs is our mandate is only to give the children joy. We have no political, religious, moral, any kind of agenda other than that.
I've been involved in lots of charities in my time and supported lots of charities in my time, but this one I really feel a participant in, rather than just a well-meaning but rather distant friend.
But we want to keep on going, and in order to keep on going, we need to raise more money.
In the past year, we moved from a one-room office space into a 1.5-room office space.
As far as growing our network, we would like more and more corporate sponsorship. We would like more people to know what Only Make-Believe does and to come on board.
We want to see Only Make-Believe in more facilities like the kinds that we've been exploring over the last couple of years. We're not just in acute care or rehabilitation, we're in long-term facilities, nursing homes, psychiatry units, outpatient clinics, and that's where we can see more kids over a longer period of time, and that's where we should be, and that's where we want to grow.
I like to believe that only make-believe has made a difference, yes.